Getting vaccinated against human papillomavirus, HPV, and hepatitis B is one of the most powerful cancer prevention strategies available in modern medicine, offering protection that begins early and lasts a lifetime. These two viruses are responsible for a significant proportion of preventable cancers, and the vaccines developed to target them have transformed what used to be unavoidable risks into manageable, avoidable outcomes. By harnessing the precision of the immune system, these vaccines offer a safe, effective, and proactive way to block cancer before it begins. HPV is a very common virus, transmitted primarily through intimate skin-to-skin contact, and most sexually active individuals will be exposed to it at some point. While many infections are cleared naturally, certain high-risk strains of HPV can persist and lead to cancers of the cervix, anus, penis, vagina, vulva, and the back of the throat, or a pharyngeal cancer. The HPV vaccine, when given before exposure, ideally in adolescence, can prevent over 90% of these HPV-related cancers. What's extraordinary about this vaccine is its long-lasting protection and broad impact. As vaccination rates increase, rates of cervical precancers and genital warts have dropped dramatically, and population-wide immunity offers protection even to those not yet vaccinated. Similarly, hepatitis B virus, HBV, is a major global cause of liver cancer and chronic liver disease. Transmitted through blood and bodily fluids, HBV can be contracted during childbirth, through unprotected sex, or through unsafe medical practices. Chronic infection with hepatitis B causes ongoing inflammation and liver cell damage, eventually leading to cirrhosis or liver cancer. The hepatitis B vaccine, part of routine childhood immunizations in many countries, is over 95% effective in preventing infection. It also protects against the long-term complications of liver disease, giving individuals a lifetime advantage against one of the deadliest forms of cancer. For adults who are not vaccinated as children, especially those in high-risk groups such as healthcare workers, travelers to certain regions, or people with multiple sexual partners, catch-up vaccination is highly recommended. What makes these vaccines so impactful is that they are preventive at the root cause. Unlike treatments that manage cancer after it appears, vaccines stop the process before abnormal cells even begin to form. This shifts the conversation from fear to foresight, from reacting to disease to building immunity against it. And because these vaccines are backed by decades of research, rigorous safety monitoring, and overwhelming evidence of efficacy, they represent a rare win-win in public health: low risk, high reward, and a massive potential to reduce suffering on a global scale. Getting vaccinated is not just a personal health choice. It's a communal act that contributes to herd immunity and reduces the overall presence of these viruses in the population. As more people are immunized, the risk of transmission falls, offering indirect protection to those who are vulnerable or medically unable to receive vaccines themselves. This collective shield strengthens public health systems and allows for resources to be directed toward other pressing needs. The emotional benefit of vaccination should not be overlooked either. It provides peace of mind, for parents protecting their children's future, for individuals taking control of their health, and for communities working together to reduce the burden of preventable disease. In a world where cancer can often feel like a matter of chance, these vaccines offer a rare degree of certainty and control. They are quiet triumphs of science, delivered in a moment, but protective for decades. Ultimately, HPV and hepatitis B vaccination isn't just about avoiding infection. It's about securing a safer future. It's a clear, simple action that can prevent pain, preserve health, and potentially save lives. In the fight against cancer, few tools are as straightforward, safe, and effective as these vaccines, making them a cornerstone of true prevention.